Hey everyone, welcome back to Miss Mooncycle's menstrual health class. I'm Miss Mooncycle, and today we are going to talk about the signs and symptoms of menstrual toxic shock. I am also a menstrual toxic shock survivor, so I have very personal experience with this condition, but it is nothing to be afraid of. Knowledge is our best defense. Toxic shock syndrome is a bacteria infection. It's when Staph aureus gets into our bloodstream. Anybody can get toxic shock syndrome, but menstrual toxic shock syndrome is when it is caused by use of a menstrual product, most commonly a tampon, although there have been cases associated with pads. A lot of us have been taught that if you leave a tampon in too long, that's how you get menstrual toxic shock. While it is good practice to be mindful of how long you have a tampon in, leaving it in too long is not the only way that you can get menstrual toxic shock. It's not the only factor, and there are other things to consider. Menstrual toxic shock happens because a bacteria enters our bloodstream. The tampon provides a surface area for that bacteria to grow. Also, when we insert a tampon, we're introducing oxygen into that environment, which also helps bacteria grow. And then we also can create microscopic tears when we're inserting that tampon, which gives an entryway for the bacteria to get into our bloodstream. So knowing all of that, it may occur earlier than 8 hours, it could occur later. We don't know. The most important thing is to be in tune with our body and know the signs and symptoms. Menstrual toxic shock mimics the flu. So that can look like headache, nausea, fever, vomiting, diarrhea. It can also be more severe, like an increased heart rate, low blood pressure, seizures, skin peeling, and a sunburn-like rash. If you exhibit any of these symptoms, immediately remove the tampon or another product if you have one in, and seek medical attention immediately. Time is of the essence with this condition. It is very preventable, it's also very curable, but time is of the essence. So it's really important that if you are in tune with your body and you notice anything being off or feeling not right, you want to take the product out and get help. If you feel better when a tampon is removed, then that may be a sign that you want to explore other products because maybe your body doesn't agree with tampons. You also would want to notify somebody if you are not feeling well after removing a tampon and say you decide to take a nap or something, because if the bacteria did get into your bloodstream, then it could deteriorate or make you more sick while you're taking that nap, and you just want to be on the safe side. I know this condition is really scary to some people, and it can be if it's left untreated, but you are already taking a step in the right direction by watching this video and knowing the signs and symptoms. Like I said, the most important thing is being in tune with your body and knowing when something is off. And if it is, take the product out and talk to a trusted adult. I'm always happy to answer any questions, so if you have any, leave them in the comments. And don't forget to like and subscribe so you can join us next week where I will share my own personal experience with menstrual toxic shock. Later!